Hi there. Welcome to another episode of Shaah with the European Union. I am Hassan Gedi Santur, your co-host. On March 16, 2020, Somalia recorded its first positive case of the coronavirus. According to the federal government's Ministry of Health, as of the first week of June, Somalia has had over 2,000 confirmed cases. In a country with an already fragile healthcare system, this pandemic could prove to be devastating. This is why a number of international NGOs are working with the government as well as local NGOs to limit the spread of the virus. The World Health Organization and the European Union have recently teamed up to combat COVID-19 across Somalia. To tell us more about the efforts of these two organizations, I have with me Dr. Mamunur Rahman Malik, WHO's representative for Somalia. He is joining us from Mogadishu. And we also have EU Ambassador to Somalia, Nicolas Berlanga, who's joining us from Brussels. Thank you both for joining us. I'm going to start with Dr. Malik. Dr. Malik, can you give us the latest update of the situation in Somalia with respect to COVID-19 in terms of, hospitalization, testing, contact tracing, and so on?
Thank you very much for your question. We all know Somalia is going through a severe crisis one after another. For the last 2 or 3 decades, the country is going through either climate shock like flood and drought, or sometimes humanitarian crisis and including armed conflict. So we knew that the health system of this country is weak and fragile. The country is also devastated owing to the fact that in 2017 and in 2018, the country went through a very large and devastating outbreak from cholera and measles. In 2019, we haven't seen any major outbreak from infectious diseases, but the country was still recovering from these two major outbreaks in 2017 and also in 2018. This year, during the first quarter of this year, I think the country faced one of its major and devastating outbreaks in its history, which is COVID-19. Since the first case was confirmed on 16th of March, the cases have been increasing rapidly. There has been a rapid acceleration of cases during the month of April as well as during the May. Gradually, owing to the population movement, cases spread to all other states in this country. What we see now, cases continue to increase in large number if you look at the weekly progression, as well as the number of deaths. And I think Somalia has reported one of the highest number of deaths amongst all other countries in East. What is also important to understand that at the very beginning of this epidemic, we saw that every 5 days, cases were doubling up. Although in present time, we have seen that this doubling time has increased, meaning that every 14 or 10 days, cases are doubling up. Nevertheless, as the surveillance system is weak and was not able to pick up all the cases, we have seen great level of fluctuation in the number of cases that are being reported from one day to another. So we are expecting swing and a spike of cases between 1 week to another that may not be truly representative of our understanding on how this epidemic is progressing. Nevertheless, it is quite clear that cases will continue to increase in the coming days because what we have observed that some of the important public health measures like case isolation, testing, contact tracing have not really worked very well in this fragile and weak setting. And also because of the behavioral factors, maybe because of the societal reasons, this isolation and also shielding some of the people who might be infected in large number compared to others have not worked very well. And also the testing facility is not adequate. When the first few cases were reported in this country, the country did not have a single testing facility. But now the country has 4 testing facilities. Of course, the testing have been ramped up, but nevertheless, there is no proactive testing strategy. And as such, we don't see that all the cases or all the suspected cases that are occurring in the community are being tested on and reported. So therefore, what I would like to say that despite all these challenges, what we see that the number is increasing, The number might continue to increase in the coming weeks or in the coming days. But at the same time, we also need to ensure that some of the basic public health measures like isolation, tracing, and also testing need to be ramped up.
Thank you so much for that update. I just wanted to do a quick follow-up in terms of the low testing that you speak of. Is it a question of lack of resources or poor infrastructure in terms of being able to travel around the country and do the testing? What's the explanation for that, if you can?
I think I would explain that in two ways. Number one, that I said at the very beginning that this country had only recently established testing facilities. So it has been functional only since April this year, and it's still they need to test more depending on facilities because they need to really maximize the available testing facilities, which has not been the case. The other important elements to think is the risk communication because people are not coming for testing. So the community engagement, risk communication, and the trust of the people and the community on the public institutions have not been adequate. And that is one of the reasons why people are not volunteering to come to the health facility for testing. So these are the two drawbacks and limitations we have currently for testing, and not really reaching to the level that we all want to reach.
And Ambassador Berlanga, the last time we talked, you spoke eloquently about the need for greater cooperation and partnership in order to fight this deadly pandemic. Can you tell us a bit about some of the ways that the EU and the WHO are working together in Somalia when it comes to fighting COVID-19?
Well, I'm very happy to be part of this conversation, and in fact, the fact that we are doing this conversation together, Dr. Malik and myself, that's a good sign of this cooperation, this collaboration that I mentioned when we talked some weeks back. And in the meantime, I think we have consolidated this relationship. I hope that Dr. Malik feels that the delegation of the European Union has been a good advocate to some messages at policy level that should be transmitted to the different authorities, not only at central level, but also in some of the federal member states or in Somaliland. But we have reinforced also our logistic collaboration, being always ready to back the normal work of WHO, delivering equipment to the different, again, federal member states and Somaliland. And I will say also, I will mention the fact that we are also in some way collecting information from WHO that we are later on spreading to the international community, given a factual picture of the reality of COVID in Somalia, at the same time, again, being an intermediate for these sustained efforts that will be needed to overcome COVID, because even if cases may decrease in the next weeks, COVID will stay with us for some time, and COVID will become some kind of another health challenge in Somalia, and then we have to take the lesson from this emergency to the health system and the community health worker network should come out reinforced from the pandemic. So I would like just reiterate my high thanks to the work that WHO is doing during these days, and also for the good attitude with us to create this kind of partnership.
Yeah, absolutely. And this question is for both of you. The European Union's partnership is not just with other international NGOs. The EU delegation in Somalia, and as I'm sure is the case for WHO, relies heavily on cooperation and partnership with the Somali government, federal government that is. Can you talk to us about the relationship that both of you have fostered with the Somali government and how that has been impacting your work in Somalia?
Maybe I can start. And I think we have forged our partnership with the European Union delegation in very recent time. And I would say this is one of the most important and critical gains that we have achieved. Because what is happening now that we have gained diplomatically, we have gained politically through our this collaboration with the European Union, something that we could advocate. We could not advocate before. Now European Union is advocating on behalf of us for improving health and well-being. This is also an important from the policy perspective because European Union is working diplomatically, politically with the government. So they are in a better position to promote that visions, to promote that idea that what is important for improving health, what is important for combating this epidemic, what is important to keep aside our political differences and work collectively for a common goal and a common purpose in mind. Despite the fact there is political differences, there is a problem with the reconciliation, but I believe that ambassador and the European Union is working to promote health as a piece, as an instrument to promote the idea of having reconciliation, the idea of having a common understanding, an idea of forging solidarity to fight against this common enemy. At the same time, I suggest and I feel that the European Union is also advocating for us in the donor community, giving the true picture of the situations. What are the priorities that the health agencies like us will need in the coming months or the coming years? And what are the priorities that we need to invest to make sure that everyone, everywhere in this country can access to quality healthcare, not necessarily only for COVID-19, but for routine healthcare services. So I would suggest that forget about the logistic support that European Union flights are giving, but that political support, that diplomatic support is more important for us to promote this universal health coverage, to promote the idea of having an universal healthcare and improving on primary healthcare system so that everyone everywhere in this country can access quality healthcare. So that's an important gain that we have achieved over the next few weeks.
Well, I can only confirm Dr. Malik's word, and you ask specifically about the way we deal with the government, and I think this new awareness about the importance of a good primary healthcare system has extended also to the government, to the authorities. I think we will all come out of COVID with this clear issue in our minds. And probably because we were all before the crisis, all more focused on issue of like private sector development and job creation. I think the crisis has been like a warning sign to tell us, yes, but do not forget that public services, and in particular, a good primary health care is absolutely necessary to have a solid foundation for the rest. So I think that that message that definitely from that we have absorbed ourselves at the EU level. I think now this is a message that it is also inside the authorities all over the country.
The European Union has been the bridge between us and also the government machineries and the hierarchy of this government. Because our counterpart is the Ministry of Health, but what we could not do is to link health with developmental issues. But perhaps this collaboration that we have forged in recent time has helped us to promote this idea and to put this linkage back between health and development and how it can contribute to economic growth. Because this understanding that we are having today that we need to invest on health, and if we can invest on health, that can contribute to development, that can contribute to recovering from this fragile situation in a better way, in an appropriate way. I think this is the message that the European Union and his ambassador is promoting, advocating, and advancing to the higher government hierarchy. And that's the bridge we are very proud and appreciative of.
Mm-hmm. Fantastic. Thank you. I know you spoke a little bit about some of the needs in terms of COVID-19 in Somalia, but I think some of it is important enough that it bears repeating. Can you talk to us a bit about some of the most urgent needs and priorities now in the country in order to contain the spread of the disease? What are some of the big priorities for you?
Thank you very much for this question again. While we are responding collectively to this COVID-19, let's not forget the other essential healthcare services that also need to be scaled up and strengthened in a fragile country like Somalia. In Somalia, 1 in 7 Somali children die before their 5th birthday. The lifetime risk to maternal death in this country is 1 in 22, meaning that 1 out of 22 pregnant women have a high risk of dying. Again, in Somalia, compared to any other country, the children have 17 times more risk of death dying from other preventable diseases before they reach their 5th birthday. It is in this situation our challenges could be overwhelming. Yes, we need to do more for COVID-19, but at the same time, we also need to see how we position ourselves to scale up the essential healthcare services. We have done some modeling, we have done some fine analysis, and we have seen that if essential healthcare services are disrupted, the childhood mortality in this country may increase by 20%. The vaccine coverage rate may drop by about 15%. The institutional delivery for pregnant women can drop about 12 to 20%. So this means that all the health gains that we have achieved collectively, development partners and international agencies, can be washed away, can be pushed back. So what we need is to be focused on scaling up the essential healthcare services. But at the same time, the public institutions and the infrastructure that we have built in our effort to respond to this COVID-19 in the areas of surveillance, in the areas of maintaining the testing facilities, in the area of keeping a functional and a high number of community health workforce, retaining them is particularly critical in the coming months. Of course, we would like to do more, but as the whole world has suffered from this COVID-19, we also need to be sure that we have the required funding to the areas where we think are critical for saving lives and preventing deaths. So in the areas of surveillance that we have trained close to 3,000 health workforce in the community. These health workforce are the critical element of the country's surveillance system. They need to be maintained. And not only they need to be focused only for COVID-19, but they need to focus on cholera, detection of TB, detection of malaria, detection of polio. So all infectious disease can come under the purview and the supervision of this health workforce. We also need to make sure that the testing facilities that we have established for COVID-19 are functional and they have the ability not only to test COVID-19, but for other infectious diseases like measles, like cholera, like any other infectious diseases. Finally, we are investing a lot on the health facilities, particularly at the secondary level health center, like we are providing oxygen concentrators, we are establishing oxygen plants. So these support that needs to be maintained because these can also provide care and services for pneumonia patients. This can provide care and support for patients coming for other diseases. So I think we also need to look the future, how we can recover better from these situations and how we can build back the health system in a much more better, in a resilient and inclusive way. So what I would like to highlight, the investment that we have made for the COVID-19 needs to be maintained and retained for the future for achieving universal health coverage, for achieving the primary healthcare goals that we all aspire to. So it's not a question of funding. The funding, yes, there will be always a funding gap. As far as WHO is concerned, we have a funding gap of close to $8 million US between now to December. However, the most important thing is that together, collectively, how we can do things better. I think that's the important thing, so that health system can be rebuilt for this country in a much more inclusive and resilient way.
Anything you'd like to add to that, Dr. Berlanga?
No. I mean, we will follow the impetus of WHO in favor of this collective effort. I think this is the best way we can respond not to this crisis, but also to the unveiled crisis. I mean, COVID has made visible the lack of private health system in Somalia, and I think we have to follow this track now and take advantage of the crisis to make it to turn it into an opportunity.
Mm-hmm. Absolutely.
I also feel that crisis also unlocks opportunities. This COVID-19 has also given us a sense where are the gaps, how the health system can be better resilient. So I think we need to take advantage of this opportunity and convert this situation into an opportunity of the health system in this country. I just want to remind all of us that we can only be as strong as our weakest health system. So if we talk about the global health security, we must ensure health security of these fragile states. Once we can do that, we can really talk about the global health security. So it's an imperative on us to ensure that the health system of this country recovers in a better and in a much more flexible way so that we can build upon it.
You were saying that even though COVID-19 is presenting a particular challenge to the Somali healthcare system and to Somalia in general and the international community, there are other issues, healthcare issues, as we've seen recently as a result of the rains and the flooding in large swaths of southern Somalia. There's a fear of cholera outbreak. And my question was to both of you, what is the EU and both the WHO are doing in order to mitigate the risk of a full-blown cholera outbreak in the country?
Thank you very much for this question. I think for this, what we are seeing now is a triple human tragedy, maybe. One is COVID-19, one is locust infestation, and then the flood. Of course, during the flood, every year we see an upsurge of cases of cholera, waterborne disease, and also some other common infections. Now, we have been very careful this year so that the gains that the country has achieved over the years in pushing back the cholera threat is protected. Because the country has now implementing a strategy to reduce the cholera deaths by 90%. So if you compare the figure of 2017 and 2019, the number of deaths was reduced drastically. But what we have seen this year, because we are focusing too much on COVID-19 and maybe our essential health services that is run and implemented by the government is being disrupted on and off, we see high number of deaths from cholera. It's not that comparatively high, but it's still higher than 2019. So there is a risk, and we can only anticipate there is an apprehension that the cholera might occur in various parts of these flood-affected areas. So thanks to European Union and thanks to the ambassador of European delegation, we have been able to reposition essential cholera supplies in most of the flood-affected areas. And this air bridge has helped us not only to ship essential cholera supplies, but also to ship laboratory supplies so that the testing can be done early. Case management can be standardized because we do have this standardized cholera, not only testing, but also the medical supplies, case management. Those have been prepositions in all these flood-affected areas. And we have also supplied through the air bridge offered by the European Union the materials and the hospital equipment to set up a temporary cholera treatment center for treating 100 patients. So we think we are better prepared than before, but at the same time, we need to be vigilant. Although we are having a good surveillance system in those areas and we are monitoring the threats from cholera, nevertheless, cholera can quickly upsurge and people may die quickly if the people do not have access to standardized and standard care. So that's the reason we have done it in advance. We have pre-positioned these supplies, but nevertheless, we need to follow up and make sure that all threats are detected early and cases are treated early, because cholera in this year or in this time people should not die from cholera. There are easy treatment available, and this will be, I think, a health system failure if we see deaths, high number of deaths from cholera. So I suggest that we need to work together. And again, thanks to our colleagues in the European Union for offering that air bridge, we have been able to move fast. We have been able to scale up our operations, I would suggest. And at the same time, we are also supporting other local NGOs and the partners to the supply that we are giving to the states. We are also providing these supplies to the NGOs like Save the Children, also the ICRC and other health partners, or MSF, for example, who are also benefiting from these supplies and preparing themselves in case there is an upsurge of cases. They will set up this cholera treatment center rapidly. Coming back to this cholera, I would also suggest that there is also high apprehension of, I think, outbreak from measles and also polio. This country has been free from wild polio virus since 2014, but nevertheless, there is also a heightened risk that this wild polio virus may come back. Although we are using our polio network, making sure they respond to this COVID-19 timely, but nevertheless, we are still vigilant, and we are also maintaining this surveillance for the polio virus to make sure that the polio does not return back to this country. And my third point is the measles. Again, measles is preventable. If we can really scale up our immunization coverage, and what we see now, there is a risk that the vaccination coverage may drop down. If we can't reach out to every child with the vaccines, then the measles may return back. So these are the three areas which we need to deal with, and these are the three areas we need to focus on.
I would like to add, Hassan, that this what we are seeing in with this conflicting crisis, humanitarian crisis, is that whatever we will do, in particular from our side and our relationship with the government, is to make sure that the short-term answers to this crisis do not block also a more middle to long-term reflection about these problems. So to make sure that policies do not respond only to the short-term challenges, but also keep some room for thinking and continue looking for more strategic answers to this crisis. I'm thinking, for example, about the floodings that we know that are totally preventable with some infrastructure work. So, of course, there is the urgent need to react to the floodings in different locations, but at the same time, not to forget that they are preventable and this long-term infrastructure should be built as soon as possible.
I'm pretty much asked you everything I wanted to ask you, but do you have any last words, messages, or anything that you'd like to transmit to the Somali people?
The ambassador can come first.
Well, no, I mean, I'm very happy for this initiative. I'm very thankful also for you, Hassan, to have conducted this joint dialogue with Dr. Malik, with WHO representative to Somalia. That shows the level of confidence that we have managed to build together, and I think that now it will last, and this I hope that this collaboration will last well beyond COVID. As I said now, as Dr. Malik said, this link between health and development is now more obvious, and we need to follow that track. So thank you, and thank you, Dr. Malik, also for his continuous availability to share his findings and ideas with us.
Thank you, Ambassador. Maybe I will just add that this is a new era of cooperation, a new era of solidarity. And what my message to the people of Somalia is that let's work together, let's build back things together, let's learn from this episode of this COVID-19. Let's apply our lessons to improve the health system in a way that can be more purposeful, more receptive to the needs of the common people. And we must ensure that everyone, everywhere can access to healthcare of acceptable quality without any financial hardship. And that's the message that I want to pass it on to our colleagues in Somalia, that we all have a moral imperative on that. And we will continue to work together. European Union, WHO, and other agencies, we have a moral imperative to ensure that.
Okay. Well, thank you both so much for joining me today and for taking time out of your busy schedule to tell us about what's happening in Somalia. I really appreciate it. I've been speaking with Dr. Malik of WHO as well as the EU Ambassador to Somalia, Ambassador Berlanga. Thank you so much, both.
This is our
Thank
pleasure, Hassan.
Thank you.
Thank you.